Hey everyone, welcome to the 7 days of NCLEX, but this is the Monday motivation. This is the Let's Talk NCLEX. I am so happy that we get to start this week off with each other doing what we do here at Remar Nurse, which is help you to pass NCLEX. If it's your first time, my name is Regina MSN. I am the #1 NCLEX instructor on this planet. I also happen to be the author of Quick Facts for NCLEX, the very best guide for nursing students. Hey, also, I just launched the NCLEX virtual trainer. We dropped it in November, and it is taking the nursing education world by storm. Today, we will be talking about medical surgical nursing for our topics. These come from the event that's happening right now. Love the attendance. 7 days of NCLEX. The questions will come right from the topics that we've been studying. Also, our Monday motivation topic is POW, 2020 company. What does that mean for you? Stick around and we will find out. Oh, before I begin our 7 days NCLEX topics. I know you guys are ready. You're in the mood for studying. You've been doing questions with me all week. I have to let you know that we are winding down on our phenomenal sale of the virtual trainer. You guys, the price dropped to just, I don't even want to say it, but it's happening. It's out there. $150. This product, oh my goodness, the sale ends in just a few days, okay? 3-month access, a $474 value. That is the regular price of this product right now, just $150. All right, we're gonna get started right away. Hello, everyone. Remember, each question today will come from the 7 days of NCLEX topics that we have presented. Oh, check out this VT testimonial #1 here. Recently, just a few days ago, I'm happy to report I took my NCLEX PN on December 28th and passed. Thanks, Regina, Remar fam, and VT trainer, one of our first testimonials of someone who used the virtual trainer, purchased on Black Friday and studied every day. That's just 4 weeks. 4 weeks, people. She got her license. Phenomenal. Question #1. This comes from day 2 of the 7 days of NCLEX. Do you remember this? The nurse has received report during night shift. Which client should she see first? Is it #1, a mildly confused client due for a dressing change on a diabetic ulcer of the foot? 2, an elderly stable client who just returned from an MRI to rule out a kidney stone? 3, a client whose IV pump is beeping, indicating an IV antibiotic has completed. Or 4, a client reporting sudden warmth and pain at an appendectomy incision site 48 hours after surgery. Remar nurses, what shall it be? What shall it be for you? We're talking med-surg here. This is general med-surg prioritization, and I love it. I love it, this Monday motivation. We're getting right into it. I see the answers on the screen. Here is the correct answer. Most of you guys got it. Congratulations. It is #4, a client reporting sudden warmth and pain at an appendectomy incision site 48 hours after the surgery. Why is this the priority? Because infection is extremely dangerous for post-surgical clients. And when a client who just had surgery develops signs of an infection, what can we anticipate the doctor ordering the nurse to do? What is the priority? Think about it. Go down in your mind. If a client who just had surgery has an infection, what is the priority? We have to identify what type of infection this is. So we need blood samples. We need urine samples. We're going to have to do some cultures possibly of the site. So these things are so time sensitive because the sooner you get the culture, the sooner the laboratory can grow the bacteria or whatever, and then the patient can be treated. So when you look at a patient like this compared to the other ones, some people may have thought, well, why wasn't it #3? Well, #3, A beeping pump could indicate that the line is clear, right? So some people may be thinking, oh, if the patient's not receiving medication through the IV antibiotic bag, perhaps they could get air in their IV. We would never pick a machine over a patient. So the beeping pump here is the presentation. All right. So it's the beeping pump or a patient who has a sudden assessment change. And I noticed that someone said, well, what about number 1? Because this patient is mildly confused, right? But the mildly confused is not the priority. It's telling us what the actual action the nurse has to do, which is change a dressing. So we have to really look at what is the task that is required to be done. So number 1 is a dressing change. Number 2, you have a patient that just came back from a diagnostic procedure to rule out what? A kidney stone. So that is just the client returning to care. All right. And then 3 is the pump and 4 is the assessment change. So we're going to go with 4. Now, let me just be clear, because right now is not 7 days of NCLEX. This is Let's Talk NCLEX Monday Motivation. So we are doing what we do every Monday, and check out tonight for the next episode of 7 Days of NCLEX. But I love that you're here. I love to have you here. We're going to go over to the next question. Question number 2, and I have a lot of questions for you guys today, so just get ready to settle in and study. Okay, this is a tricky one. This comes from day 2 of 7 Days of NCLEX. So if you were there, who has perfect attendance? If you were there, this question is for you. A newly graduated nurse is working in the pediatric unit. Which client is most appropriate for this nurse? All right, here it is. Number 1 says, a 3-year-old with hemophilia A who has suddenly become less responsive. 2, an 11-year-old with sickle cell disease complaining of lower right quadrant abdominal pain. 3 is a 5-year-old who just had a tonsillectomy 2 hours earlier and is frequently swallowing. Or 4, an 11-year-old with newly diagnosed type 2 diabetes whose parents need teaching on insulin. So check out the scenario here. We have a newly graduated nurse. What is the appropriate type of clientele for the new graduate nurse? What is the appropriate clientele for the nursing student, right? You guys, what is the expectation of the clients that you can take care of, right? This is something that you have to be able to determine on your exam. So I see the answers coming in. A lot of people are saying 3. A lot of people are saying 4. I have some 2s. All right. Put your answer down, smash that share button so every nursing student around the globe can say, I have been a part of Let's Talk NCLEX. All right. This is super fun to me. The question, I like that. Yes. Remember, guys, I'm going to tell you this and I'm going to let you change your answers. All right. Remember, the new graduate nurse is the one with the least experience. So this nurse requires a very stable patient. I mean, when you think about a newly graduated RN, you can almost think about the LPN in a sense. So just like we give the LPNs the most stable patients, you want to give the new graduate RNs the most stable patients, but allow them to still have their scope of practice intact. All right. So what do we have here? All right. Here we go. The correct answer, be shocked and amazed, but it is number 2. Yes, it's number 2. And I'm so glad that you guys showed up because you're about to be taught something that you may have missed in nursing school. All right. You may have missed it in nursing school. But anyhow, the 11-year-old with sickle cell disease reporting or complaining of lower right quadrant abdominal pain, this is the routine. This is the stable patient. All right. Actually, this is the stable patient here because pain is expected with what? Pain is expected with sickle cell disease. Yeah, they're going to have pain. So can the new nurse assess pain? Absolutely. Can the new nurse assess pain? Yes. New registered nurses, they can assess pain. Now, also, think about the treatment. If you say to the doctor, I have a sickle cell patient who is reporting pain, what is going to be that treatment protocol, right? It's going to be an opioid, right? An opioid medication. A new nurse certainly can give an opioid medication. Absolutely. So this patient just requires assessment and pain control. But let's look at the other patients. Number one was the 3-year-old client with hemophilia. And we're talking here about who is most appropriate for a new nurse, a newly graduated nurse, right? So the 3-year-old with hemophilia has an assessment change because it says who suddenly becomes less responsive, So this client, if we're talking about how the newly graduated nurses need the stable clients, this patient is not stable, number one. They're not stable, all right? They have an assessment change. What about number 3? Why isn't number 3 going to be appropriate for the newly graduated nurse? Because this patient also is unstable. They also have an assessment change. You have a 5-year-old just had a tonsillectomy 2 hours earlier, and now what are they doing? They are frequently swallowing. So that indicates bleeding. It is not going to be something that a new graduate nurse on a pediatric unit is going to be familiar with. All right. So a lot of people picked 3, but a lot of you guys picked 4. And this was a point that I really wanted to stay on for the NCLEX because the 11-year-old, why is this patient not stable? Number one, this is a newly diagnosed client. So you have an 11-year-old with type 2 diabetes. And most importantly, they need teaching on insulin. Now, for the NCLEX exam, insulin is a high alert medication. Did you guys know that? Insulin is a high alert medication. So that means that when you are considering, now let me just ask you guys this. Who determines if a medication is high alert or not? Like, what does it mean? All right. High alert medications, REMAR nurses, they simply mean that these medications, if not given appropriately, will kill your patient. They'll kill somebody, right? So let me give you this list here. And I put it on here, but it says the Joint Commission, you guys know JCO, the Joint Commission on Accreditation of Healthcare Organizations has issued a list of high alert medications. And these medications have the highest risk of causing an injury when they are misused. So I have the list here for you guys. Take a look at it. They are number 1, insulin. 2, opioids and narcotics. 3, injectable potassium chloride concentration. 4, intravenous heparin. 4, sodium chloride solutions above 0.9%. All right. So these all have the highest risk of causing a patient injury or patient death. So in this instance, we do not have the new nurse teach about these medications. So if we go back to the question here, we see specifically that the 11-year-old client with the newly diagnosed type 2 diabetes, their parents are in need of teaching. So we would not choose that one for this case. All right. So somebody says, I love these daily NCLEX check-ins. Yes, 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 yes. All right. So I hope you guys got that one. Remember that list, and we'll talk more about it. The whole reason why we do this is so that you guys feel prepared to take your NCLEX exam. Yes, you guys feel prepared to take your NCLEX exam. Let's go to the next question, shall we? Question number three says this. 16-year-old female who is prima gravida, 37 weeks gestation, is seen in the ED with a low platelet count. The ALT is 70, and they have a continuous severe headache. All right, that has lasted for 3 days. The nurse should prepare the client for which of the following? And this came from day 5, which I don't know, you guys haven't done day 5 yet. Woo, here we go. So tonight is day 5. So the nurse should prepare the client for which of the following? These are the choices, and you guys kind of already saw it, so you all should have the correct answer. But this client, should they be prepared for the amniocentesis, the ultrasound of the baby, the delivery of the baby, or a C-section? What do you guys think? What do you guys say it is? Ultrasound of the baby? Okay. I'm seeing 3s. I'm seeing 2. Somebody must have looked away. This patient, it was type 2 diabetes, Marie. Yeah, the last patient. You can also have type 2 diabetes as an infant, not an infant, I'm sorry, as a juvenile because of obesity. All right. All right. So the correct answer, this patient here, 16-year-old, very young mother, 37 weeks pregnant, and they have an ALT of 70. What does this client have? What are we thinking this client even has? All right. Low platelet count, continuous severe headache that has lasted 3 days. Well, this, guys, these are all signs of preeclampsia. So the correct answer is, in fact, number 3. All right. We need to get that baby delivered. Remember, guys, if you're studying the VT, you haven't done labor and delivery yet. The only cure for preeclampsia is to deliver the baby. So number 1, the ultrasound, the amniocentesis or the ultrasound, not necessary. Not necessary, will not help. The C-section at this time is also not medically necessary. We don't want to just propose surgery if there is an alternative way. So we would try to definitely deliver the baby first, right? And if that fails, then we would do the C-section. Because remember, when you talk about preeclampsia, it's not the baby who's in danger, it's the mother. So the baby is fine. The baby's growing healthy. The baby is just doing its own thing, but it is the mom who is in danger. So we need to get the baby out of the mother, and that will resolve all of the conditions. All right. Let's go on to question number 4. We still have so much to do. So everybody that just came in late, don't worry. This is the session that you have a lot left to do. All right. Don't worry, Marie, you're in here. Question number 4. This comes from day 4 of 7 days of NCLEX, where we talked about delirium and dementia. So the nurse is caring for a client with dementia who has pulled out 3 peripheral IVs. Which intervention by the nurse is the best way to manage this client? Number 1, place the client in restraints. 2, tell the family they need to stay with the client. 3, replace the IV and wrap it in gauze to hide it from view. Or 4, tell the client that if she pulls another IV out, she will have to have a PICC line placed. All right, Remar nurses, we are talking NCLEX, which is going to be the most appropriate, the best way to manage the client with dementia. Oh, this is perfect. All right. This is perfect for new graduate nurses because you know what? More and more of our elderly patients are experiencing Alzheimer's and dementia. We got to know how to manage them. Everybody's saying just do 3, just do 3, just replace that IV. All right. All right. Also, some people are saying 1. Let's restrain this client. We won't have these issues if we restrain them. All right. What's the best answer? All right. The correct answer, guys, is actually, congratulations, it's number 3. For clients with dementia, the best when it comes to pulling out IVs, replace the IV, wrap it in a gauze to hide it from view. Clients with dementia pull out IVs because they know they don't normally have one. But if you place it in an inconspicuous place and cover it, the client won't even realize that it's there. They really won't. They won't realize that it is there. The reason why number 1 is inappropriate is because remember, for your NCLEX, if a client has dementia, restraining them only adds to further agitation and confusion. So it's just not a good choice to pick, honestly. There can always be something that can be in place before restraints for clients with dementia. Like here, you can wrap it. You can also have a sitter to sit in the patient's room, so they don't get out of bed and fall. But to restrain a chronically confused patient is not a good look for nurses. Not a good look. All right. And then, so 2 says, tell the family they need to stay with the client. Family members are not part of the healthcare team. All right. That was a good, I'm gonna make that comment too, Belinda. But they are not part of the healthcare team. So in general, nurses, registered nurses and licensed nurses, we cannot delegate to the family members to provide care. And they may be there visiting the client, but at the end of the day, they're not getting paid to do what you are getting paid to do. So it is not appropriate for you to say to the family member, can you go get the patient fresh water? Or can you feed the patient their lunch? That's not the family member's job when they are admitted to the healthcare facility. That's your responsibility as the nurse. So for NCLEX, never delegate any nursing care to the family members. I don't care how eager or happy that they are to do it. You cannot say, hey, since you're here, can you give this bed bath? You can't do it for NCLEX, all right? So that's why number 2 is going to be inappropriate, all right? Number 4, so this is wrong on so many levels. Telling the client that if she pulls another IV out, she will have to have a PICC line placed. Number 1, this client has dementia, so probably after you say that sentence, they're not going to remember it. 2, you're threatening the client, which is never right. Never right for NCLEX. Never threaten a client for anything. And then 4, like Belinda said, reason number 3 is, can dementia patients also pull out PICC lines? Absolutely. And I totally forgot about that. But yes, if you put in a PICC line and a demented patient pulls it out, where is that PICC line coming from? Right? That's a central line. So they're going to pull it all the way out from the catheter that's placed right in the heart, right? So imagine, the damage that's going to cause that patient. So the only correct option that we have here is number 3. All of the other ones don't make sense. All right. Team Remar 2020, getting our license. We're already there. We're in the future. All right. We're just preparing ourselves. This is question number 5. All right. This is question number 5. Now, it says a nurse, this comes from day 6. We haven't gotten there yet, but this is the topic. A nurse is caring for a client on an IV antibiotic for MRSA. When the nurse enters the client's room, she smells cigarette smoke. When confronted, the client states, I only smoked 2 cigarettes because I'm having bad cravings, right? Which action by the nurse is most appropriate? Okay. So number 1 says, escort the client outside to the safe smoking area. 2, call the healthcare provider to obtain an order for a nicotine patch. Oh, this is so good. 3, remind the client that oxygen is in use and smoking is banned in the facility. Or 4, tell the client that if he continues to smoke in the room, he will be discharged from the hospital. Okay, Remar nurses, have at it. This is one of those questions where it causes you to really critically think. Yeah, it really does. And I'm not going to say any more because I don't want to give away the answer. All right. What do you guys think the answer is? Don't look at what other people are picking. Think of it on your own. And I'm going to tell you, if you get this question right, you are ready to pass NCLEX, period. You are more than ready to pass the exam. Quit playing around, take the exam and pass it so you can get your Remar nurse shirt. Oh, this is a new one. This is a new shirt. All right. Hey, this is a new design. All right. So what is the correct answer? What is it? What do you guys say? The correct answer is number. I want to show you right now. It is number 3. Yes. Oh, please don't forget that when it comes to NCLEX, the priority is safety. The priority is client safety, hands down. So this client smoking inside of their room, they have to be reminded that oxygen is in use in a hospital. All right. And there are so many instances where there have been actual explosions to take place because somebody was smoking a cigarette near oxygen. And if the patient does not want to stop smoking, then you know what? You got to call security because at the end of the day, everybody has to be safe. Everybody has to be safe. All right. Number 1, I didn't see too many people pick number 1. But that says escort the client outside to the safe smoking area. Doesn't that sound good? That's really just a great distractor. All right. So it sounds like, yeah, I'm going to show you exactly where you can smoke, but that's not the priority. Like the priority is this. The patient needs to understand that they can cause an explosion. And if you escort that patient off the floor outside to the smoking area, then you have to give up all of your patients to another nurse just so you can take that patient outside. Does that make sense? And so that's not going to be cool. All right. 2 was talking about getting the patient a nicotine patch. And that sounds very good too. But guess what? Like the Remar nurse said, the patient didn't ask for a nicotine patch. The patient might not want to do nicotine. The patient just might really want to smoke cigarettes. So you can't be trying to come up with alternatives for the patient without bringing them the reality of the situation, which is you're going to blow up this entire place if you keep smoking in here. This is a hospital, all right? And then, so 4 is not right because, again, you can't threaten a client. Just a period, all right? So you can't threaten a client with discharge as the nurse for NCLEX. All right. So good job. Congratulations, y'all. Let's keep going. Oh, let me show you the new design. So all the Remar nurses who are passing, giving their testimonials, we got new designs because I know some of you guys wanted long sleeves. So we got long sleeves here, it looks like. So you pass NCLEX, you get the Remar nurse shirt with God is possible. Super cool. All right. We're moving on. What question number is this? Hey, this is question number 6. A nurse is giving instructions to parents of a child who had a tonsillectomy. Which instruction is most important? Number 1 says, drink orange juice to relieve discomfort. 2 says, milk is the best fluid to consume after surgery. 3, avoid drinking from a straw. Or 4, use the antiseptic mouthwash twice a day. All right. So here we go. What is the best answer here? All right. All right. Mrs. I love this new information. Yes, this is where we are striving for greatness. You guys are all future educators. I can't do it alone. I need you guys to contribute. Here we go. The correct answer is going to be number 3 is the correct answer. All right, the correct answer is number 3. And the reason why it's number 3 is because with drinking from a straw, the sucking motion can cause injury to the patients. And most of you guys got it right. The sucking motion can disrupt surgical clots, all right, that are formed to help protect the patient. And the straw in general may cause its own injuries. Now, number 1, the reason why number 1 isn't correct, and most of you guys had it, number 1 is very acidic orange juice. So that's going to irritate who, and this is like a tangent, people who consume a lot of dairy, cheeses, milk, mucus production. Sometimes they have problems with asthma and other inflammation because of the dairy. So we got to watch what we're eating. All right. So here we go. So this one is, that's why number 2 is not right. 4, using antiseptic mouthwash can also cause from a straw. Avoid drinking from. Questions here. The questions is, do these questions come from the virtual trainer? These questions will all be put into the virtual trainer. I'm going to change them a little bit because actually what I was doing was giving you guys questions based off of the 7 days of NCLEX that we're doing right now. So these questions are new, and I'm just trying to challenge you guys to dig a little deeper, but all med surgical topics. So you guys have to be very comfortable when it comes to med surg because it's general. All right. Question number 7. This comes from day number 3 of the 7 days of NCLEX. This is providing discharge teaching to a client newly diagnosed with heart failure. Which statement by the client indicates an understanding of the side effects of furosemide? Okay. So we're talking about furosemide here. Which statement by the client indicates an understanding of the side effects of furosemide? So number 1 says, I should eat bananas, dried dates, and peaches every day. 2, I will monitor my heart rate. 3, I will avoid foods containing tyramine. Or 4, I will not take my medicine when I have to take a long car trip. All right. So which statement is going to indicate an understanding of furosemide? Okay. An understanding of furosemide. And you guys that are showing, taking time out of your busy day to go over this information, and everybody should know this answer, very general. Let me say this. If you are getting these wrong, it's simply a matter of content. It's nothing else. You don't need strategies. You don't need more practice questions. You need to study the concepts, all right? Because this is very general things. So the correct answer is number. So daily consumption of high potassium food is very important to clients taking furosemide. And furosemide is one of those medications that you definitely have to know. All right. We definitely have to know. So all I'm going to say is that, this is just very basic. All right. So Facebook, I'm looking at it. A lot of people, most of you guys picked one or two. So one is going to be the priority here. All right. What I want to do now actually is during, I think it was day 3, I missed a question on the pharmacology review. So I'm going to go over that question. It was actually part of the case study. So I want to go over it now, just in case you guys missed it during the broadcast, okay? So here was the question. Here was the case study presentation. It was this. All right. So it was a case study presentation. Mary Jane, a 64-year-old female with a history of diabetes, had ingested an overdose of benzodiazepines with a large glass of wine. After that, she was admitted to the medical surgical unit. Since admission, Mary Jane has also been found to have a cocaine substance abuse habit, all right? A substance abuse habit. So this was Mary Jane, and this was our patient that we were talking about, all right? So the question was asked about Mary Jane. It was this. Thinking about Mary Jane, her husband, Carl Jane, the husband of the client, comes for a visit. He tells the nurse that when Mary discusses her best friend's death, she uses more drugs. So which members of staff should be included on the interdisciplinary team? Select all that apply. Okay. So you guys know the patient, which members should be included on the interdisciplinary team. Okay. All right. And just again, these questions come from the 7 days of NCLEX. So I wrote them based off of what we talked about during that time. All right. And I see the answers. Yes. Yep. I see the answers. Okay. And I'm going to reveal it to you. All right. I'm going to reveal it to you. But remember, we went over the interdisciplinary team. Remember, the focus of the interdisciplinary team is to keep the clients safe, help them to avoid any complications that may result from them being in the hospital. So the more complex the patient, the greater the need for a larger interdisciplinary team. All right. So here, the correct answer was, it was 1, 2. The correct answer, I'll go over it again. Can you check, please? The correct answer was, and it may be the battery, actually, here. Yep. So the correct answer was 1, 2, 3. Hold on. 1, 2, 3, 5, and 6. You know what? If you give me my laptop, I'll be able to go over it. Just when I needed that question most, the computer died on me. So I need Mark to go get his charger. You guys got to blame my Mark. All right. So, and the reason why, let me go over, actually, let me grab my laptop and then I'll be able to go over it. But Mary Jane had a few issues that she was dealing with. So first of all, she had a history of diabetes, right? Then she also had a suicide attempt, basically by doing the benzodiazepine and also doing the wine. And then we found out that her husband said that she also abuses cocaine. So her interdisciplinary team would have been very robust. So let me just get to it here. Help me out, guys. What were they again? Because of course my computer is acting crazy now. All right. And this is the backstory of when you go live on Facebook and things like that. All right. So her interdisciplinary team, thanks, Mark. And Mark is getting it ready for me, and I really appreciate him doing that. So her interdisciplinary team members included the nurse, Well, you guys have 1, 2, 3, 5, and 6. Okay, so it included the nurse for sure, because the nurse is going to be the one who is going to be able to direct that patient care, right? I mean, not direct the patient care, to direct the medications being administered. The psychiatrist was needed because the psychiatrist was going to help Mary Jane with her emotional issues of her friend's death. And then the healthcare provider, of course. So let me show you guys now. All right. The healthcare provider is going to prescribe the medications to treat the condition, right? The dietitian was important because somebody with diabetes mellitus, they're always going to need counseling on how to have a healthy diet to control the blood glucose measures. And of course, the pharmacist is going to be there because this patient is going to have a lot of potential for medication interactions. All right. So yes, the pharmacists and the dietitians, they are part of the interdisciplinary team. I mean, that's why it's called multidisciplinary or interdisciplinary, because you have professionals from different expertise. So the pharmacist, of course, you'll always need a doctor and you'll always need a nurse. And the dietitian is because the patient has diabetes mellitus. All right. Okay. So any questions about that? Had a little interruption, but any questions about that? Why the pharmacist? Why do we need the pharmacist? All right. Do we all understand why the pharmacist is important now? Because the pharmacist has to clear the medications that are going to be prescribed, to this patient, right? And any other questions about it? Tonight's broadcast starts at 8 p.m. Eastern Standard Time right here. All right, so now your Let's Talk NCLEX was brought to you by 7 Days of NCLEX. So all of these questions I presented to you guys, I wrote because of the topics that we have been over or that we will go over today. So somebody was like, I didn't see these in VT. These are from 7 Days of NCLEX. So I hope you guys are taking part of it. I hope you have printed out your 7 Days of NCLEX workbook, because there's a lot of questions in there that are new and that will be helpful for you. So make sure that if you're watching tonight, you have this workbook. All right, you have this workbook. Now, I want to get into just the Monday motivation for today. Our Monday motivation is future thinking. It's 2020. This is how I want you guys to proceed into the new year. But the way I'm going to demonstrate that is actually looking at a blast from the past. All right. So we are going to talk about this testimonial. And I don't know if you guys saw it, but Christmas Day, this came in. She said, this is the 2019 greatest testimony. And here it is. She said, grace is God. This is her worship before the testimony. Grace is God's absolute favor. It's kindness from him that none of us deserve. A month ago, our long cherished dream of owning a house has been fulfilled. Today, we are thankful and happy to celebrate this holidays 2019 in our first new home. This is a real Remar nurse in her family saying they're celebrating their first holiday in their new home. And this is what I want for you guys. This is what I want. I want every one of you to be able to say this, to be able to our nurse passed last year. And she posted a video where she gave her testimony last year. So this is significant to say that I did this thing for myself last year, and this year I'm able to bless so many other people. And that's what I want for you guys. I want you to be able to say, I did this thing for myself this year, right? 2019. So in 2020, I'm able to bless my entire family. But I'm spotlighting Nurse Catherine because her backstory is tremendous. I see her with her new house. I see her with her kids looking super happy. But this young lady has come from She's come from an amazing place. All right. You see her now. You see her smiling. She wrote an email to us. She also posted it on the group. But essentially, I'm just going to read the beginning of her. I'm going to read the beginning of it. All right. So it says, my nursing journey. This is the backstory. So everybody that thinks that they have a challenge and they think that they're alone, they're not. Okay. My nursing journey. I started as an RN in 2010. Then in 2012, I was diagnosed with cervical cancer stage 4. So she started as an RN student. That's what she's saying. All right. In 2012, she was diagnosed with cervical cancer stage 4 and was told I had less than 6 months to live without a surgery. All right. So how many people think they got problems? How many people think that they have problems and right now they have this tremendous challenge and they can't do it and they don't have the time and their life is so hard? We have Nurse Catherine here saying that she was told that she only had 6 months to live, stage 4 cervical cancer. All right. She says, I went through a depression and suicide, then flunked out of nursing school. This is the same young lady that just told us she bought a house. How do you get from flunked out of nursing school, depression, suicide to buying a house? All right. She says, but God, all right, saved me by grace, even when I was out of the RN program. But I have life and enough credit to have an associates at SUNY Morrisville. So in 2013, SUNY Canton accepted me with the nursing credits that I had already completed to start their LPN program. She said, so I did it and I graduated as an LPN May 2013, but received her diploma in August, right? So God's grace, all right? She says, but when I was completely done, I still couldn't take the exam because of what? Because of life. So her mother's residency had come up, right? And so she had family issues. So many of us have family issues, right? So in 2014, she took 3 months off to study for her boards, 3 whole months, right? But she failed and she was devastated. She says, I was using mostly everything out there. Nothing worked for me. I used Kaplan, ATI, NCBSN, Saunders, PDA, Exam Cram, Lipton-Cott, NCLEX Mastery, Happy NCLEX, Mark Clemec, UWorld, Remar, etc., and 2 or 3 of them at the same time. Here she go, 2 or 3 of them at the same time. Some of you guys know that, right? Out of school, all right? This is tremendous perseverance. She tested 7 times, all right? 7 attempts. She can now say that she was a Remar nurse. She was a Remar nurse. And one of the things that she goes on, because she did have a very long, if you want to look at our page, she had a very long testimonial. She said that what she was doing using multiple resources at one time was totally ineffective. So she stripped down to just the Remar program, and she used the Remar program and she was able to pass. Glory to God. Came from a place where it was impossible. It seemed impossible. Her life was given an end date. All right. A lot of us think that we have issues. A lot of us think that we have problems. Yes, Myrna, this is what you call a testimony. All right. When you are told that you won't live to see the day, right, that you can even test. You won't live to see it. But not only do you live to see it, now you can bless others. Now you can bless your family. This is that same nurse, y'all, right? This is Monday motivation for you guys. So whatever you feel like today you are dealing with, Nurse Catherine is saying, by God, if I can do it, you can do it too. But it starts with this first step. Right? It starts with her saying, number one, I can do this no matter what anybody else is saying. God has the final answer, right? God has the final say. So it's not only I can do it, I will do it, I must do it. I can do it. I will do it. And I must do it. So, thank you, Nurse Catherine. The Monday motivation was totally organic today, came from the Remar nurse family. And I so appreciate when you guys take the time out to give back. Take the time out to give back to us. Remember, 7 days of NCLEX is happening. Make sure that you have your workbook. I can't stress it enough. You need this workbook for this. Also, you guys, don't forget right now, somebody was saying that the Monday motivation questions, Let's Talk NCLEX questions, did they come from the VT? They will be uploaded to the VT. The virtual trainer is on sale right now as well. $154, the duration of 7 days of NCLEX. And have it on the tablet here. You certainly can do your studies. I prefer it on the tablet. I know some of you guys are using it on the phone, but actually the best way to use it is when you go to your tablet or go to your laptop and you're able to have your training center, your report card, all the fun little goodies that personalize this. I heard Jessica talking to a customer today and she said, it's your own personal review. It's your own personal review. So, and it's right there for you guys. So check it out right now. 7 days of NCLEX. During this promotion, we will have the VT on sale for just $150, like just $150. And I say why? So while supplies last, because literally this workbook comes with it. And once this workbook is gone, then it won't be any more supplies for it. So we're just having an opportunity before the year is out to have more testimonials like Nurse Catherine, And I see you guys asking me about questions. Listen, I'm coming. I'm going to give you guys the perfect question bank for the virtual trainer. It is coming, guys. Just trust me and believe me, but I got to make it perfect for you guys. Somebody says, okay. So yes, the question bank is coming. It's not released yet. I told you guys I was working on the question bank during the same time that I released the virtual trainer, but I'm still working on the question bank because I want it to be perfect. And I need for it to be able to prepare the students that are going to be dealing with the changes that are taken care of, that are coming on the NCLEX. So I'm trying to make it the most advanced question bank that you guys have ever seen. All right. So someone says, yes, Nurse Catherine is such a motivation to all of us for sure. And we are always praying for you guys. Don't forget tonight, the class starts at 8 p.m. The class starts at 8 p.m. and it's day number 5. All right. I just need to be told exactly what I need to do in order to pass. It's so simple. All right. All you need to do is commit to giving yourself 6 weeks. Okay. No excuses. Nothing. Get a full comprehensive NCLEX review. I'm telling you guys, the NCLEX virtual trainer is that comprehensive review that will allow you to be competent in the core proficiencies of nursing. Remember, for NCLEX, you don't have to know everything. The test is very structured in what will be on the test. If you guys have the file vote, remember, during the lecture, I was talking to you guys about what's on the NCLEX exam, right? From the practice analysis, I was saying that there are high priority tasks that are on the NCLEX exam. So I created a new folder called NCLEX Resources in the VT. I put it right there, right? The high priority tasks. And this is what NCBSN identifies, all right? This is in the virtual trainer for you guys. The reason why I created the virtual trainer is so that I'm able to, at any point in my research or studying, I'm able to give you guys updated information. I'm in the virtual trainer all the time, updating things, adding things. So this is a way for me to directly communicate with any Remar nurse studying. There's no reason why everybody who is studying for NCLEX doesn't have the VT right now. Okay, we slashed the prices for the new year. We wanted you guys to go into 2020 with the number one NCLEX prep resource, period. The virtual trainer. And I know you guys, you have done a lot of NCLEX reviews. You've done a lot of things, but you have not seen anything like the virtual trainer. And it's a reason why. All right. All I want you guys to do is pass. All right. So, and you can do it. Yes, you can do it. You can do it. You can do it. All right. So the virtual trainer, someone says, I love nurses. Is VT good for HESI exit exams too? Well, if you think about the HESI exit exam, what they actually say is that they mirror the NCLEX test plan. So the things on the HESI exit exam can also be found on the NCLEX, right? Jeanette, shout out from Jamaica. Thank you for sharing that testimony. Nurse Guy, have much more in store for you, and I decree. Yes, 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 yes. This is definitely the season for Remar nurses. This is our year. This is takeover year. So another thing that I wanted to show you. Let me go back. There's so much here in the VT. Another thing that I wanted to show you is the file vault here. You guys know I just was there, but essentially, underneath the NCLEX resources, these are the calendars. So whether you have the NCLEX RN or the NCLEX PN, your weekly calendar is here. Okay. So when I say it's a 6-week program, this is where you get the daily information. Someone says, I failed 9 times. I'm ready to do the 6-week challenge. I did, but was not consistent. Do it again. Okay. The most precious thing that we have that we tend to waste is time. It's the time. We tend to waste the time that we have. That's the best gift. All right. So just commit to it. Just commit to yourself for 6 weeks. We give so many other things our time. We give television our time and, movies and things like that. So this is the way for you to do it. 6-week calendar, especially NCLEX PNs. You guys have to take this serious. All right. You guys have to take your studying serious. All right. So this is the RN week 2 calendar. I've been showing you guys this. Thanks, Mark, for bringing the tablet out. I structured it day by day. All right. I only have you studying 4 days a week. And I tell you exactly what to study. That's what a lot of my international nurses like about this, is that it is realistic and it gives you time to digest. So I actually put in rest days during the week. A lot of us work and we can't be studying 9 hours a day. Some NCLEX reviews, they literally just say, here's the material, go study it however you want to study it, open it up, don't open it up, we don't care. Like, this is a way for you to be successful, right? I don't want you to have a product that you're not using. And so that was one of the challenges with the DVD program, is that people would purchase it, but it would just literally sit on their shelves. And they thought, well, I'll just take it next year. So with the virtual trainer, it eliminates that mentality. A lot of us, sometimes it's just our mentality that keeps us from progress, right? It's the idea that I'll just delegate it to my future self, right? Some of us do that, don't we? We say, oh, future Regina will do that. No, future Regina is like, no, past Regina should have did that. I'm not doing it. And so you get into this battle where you don't get things done, right? So I had to stop doing that to myself, saying, well, future Regina will take care of it. No, all right. Future Regina will not take care of it. All right. So somebody says, hey, okay, I do this 13 years. Yes, it doesn't matter. 13 years. You can, you will, you must. You can, you will, you must. Okay. So I will see you guys tonight. I'm going to close. I will see you guys tonight. We have day number 5 of the 7 days of NCLEX. Get out your workbooks. All right. And get ready. Last night we did talk about ABGs and it was fantastic. It was absolutely fantastic. So tonight we have more information in store for you guys. I'm going to go over some of that pregnancy stuff. I'm taking you straight into the virtual trainer. So if you don't have it and you want to see what it's like, this is the night to do that. Free sample of the virtual trainer tonight. But also don't forget, sign up for the VT now, because when the price go up, I'm not going to be able to say, remember the time. I'm telling you, this is the time now to get your studying started. So in 2020, everybody, by Valentine's Day, we can have a big Valentine's Day party celebrating our license, and we'll be just in love with our license this year. All right. So I'll see you guys tonight. I'll see you guys tonight at 8 p.m. We're going to get studying, and it's going to be fantastic. Don't miss it. 7 days of NCLEX. See you guys later. All right. YouTube, gone.